In preparation for the third wave of COVID, the Telangana state has set up a COVID Command Control Center. In fact, we are here at the Indian Institute of Health and Family Welfare, and what you see here is the place what they call as the Command Center. All these chairs that you see here are for the officials who will be sitting here, and important policy decisions will be taken based on the information that is available. This particular screen that you see here is where all the data will be projected. Let me take you to the screen so that you'll have a better idea. For example, this is the place where the data will be put out. You can see here they have the COVID data. They also have the liquid medical oxygen data, that is the LMO. And in that also they can see how much is available and how much is being consumed and how much is being burned and the number of hours left for it to be emptied. Similarly, they have data about the beds as well. Beds also here they have the general occupied beds, that is they also have the oxygen beds, the ICU occupied beds and the ventilator beds. Here you have the data about what is the percentage of the beds that have been occupied. For example, 4%, 9%, 7.7% and 12%. On the other side, you also have a lot of information and graphical data about the various districts in the state. This is the map of Telangana. You can see the points. This is the oxygen map chart. For example, this is Kamareddy that is being pointed at, the cursor, and this is Siddipet. You can see the total supplied. They have data about how much is there at the moment. For example, if you can go to some other place, this is Khammam. Here you have total supplied 601. So that is the data that is available, and this is all real-time operational data. Now let's go to the next part, which is the bed occupancy. Just like the oxygen, they also have information in each of the districts about the number of beds that are available. For example, Hyderabad, you have 1,222 ICU available beds. Similarly, you can move the cursor and just hover around different districts in the state to give you information about how many beds are available. Also, they have this graphical data. So, according to the officials, all this data can be analyzed and important policy decisions can be taken. For example, if they have to lift a lockdown, the kind of impact that it can have, when are they expecting the next wave. So, these are several important decisions that can be taken. The COVID-19 Command Center was inaugurated by Minister Rama in the last week of June and is located at the Indian Institute of Health and Family Welfare premises in Hyderabad's Vengalrao Nagar.
Telangana was one of the first states to start using data very intelligently. We had access to multiple kinds of data and we put together a good system through which we could use that data to forecast what would be the spread of COVID, what would be the hotspots, the containment zones, and all that planning and management really helped us in good stead. But we know for sure that COVID is not completely out of our lives. There could be a third wave, there could be a fourth wave also, there could be other kinds of disasters. So we have decided to bring together all the individual departments who use data, who create data, who manage data together in this wonderful COVID command and control system.
The dashboard of the center will provide an overview of all the key metrics to assess the COVID-19 situation. The system, equipped with data analytics and artificial intelligence, will help officials in taking decisions regarding all COVID-19 related demand and supply status and optimal allocation mechanisms.
So firstly, the COVID Command Center that we've developed in the state of Telangana not only tracks all the data that we have available in the state, but also gives us more functional aspects on how we can take this, policy decisions, etc. And effectively monitor how COVID is going to grow and how we can stop the growth of COVID in the state itself. So we are also coming in with more AI and ML based solutions to understand how the forecast will be like, how our policy decisions will impact the state and so on.
The control room consists of a command center and a call center. While the command center will be where the officials are seated, the call center has dedicated staff who will be available 24/7. They will be answering the calls that they receive on the helpline number 1905. The COVID Command Center has two main parts. One is the command center and one is the call center. We are right now inside the call center and you can see how the staff are there. They have been deployed to take calls People from across the state can call and ask for details. Let me quickly show you one of the systems to show you how the portal works. In fact, this particular box here, that is where the call details come. So once a caller comes, they copy the number, they paste it here, and you can see how the details about the name, last name, the patient details, and also the information that is being requested. The request information, the type, the district from where, and also information about where the nearest testing center is, in case it is about hospitals, also ambulance service requests. So anything regarding COVID is attended here. They also get calls regarding telemedicine, that is, they connect them to the respective doctors so that information can be given, treatment can be given through the phone. Also, a lot of information is passed regarding COVID, and psychological counseling is another important aspect, wherein a lot of people are calling asking for psychological counseling. So this is what the call center does.
So I think India as a whole has been extremely hit during the second wave, and it did cause a lot of, I would say, panic among the citizens globally also. So what we have decided is that we want to create a system which is extremely robust, which is time consuming, which can attend to queries in a short span of time and also be as useful and as robust. So that is why we have come up with the COVID command call center, which is going to be used as a step for preparation in the third wave. So any citizen can call the COVID helpline number and get their queries resolved or whatever information they need with regard to COVID in the same call itself. So I think our motive is that we want to facilitate intra-departmental coordination. We want to make sure it is done in an extremely robust way, and we also want multiple points of data to be collectively there at one focal point. So I think this is one step that we have done in preparation for that.
By setting up a state-of-the-art command center and a 24/7 call center, the government hopes that it has taken a step ahead before the pandemic's third wave. In fact, they're also hopeful that the same facility can be used for any kind of coordination during any disasters, even after the pandemic is over. Reporting from Hyderabad's COVID Command Control Center, this is Paul Umin for the News Minute.